All right, class. For these PowerPoints, what you want to pull up in ANP2 is coronary artery disease and coronary artery disease 2. My coronary artery disease 2 is a pictorial presentation. This particular PowerPoint will show you coronary artery disease, which is also called ischemic heart disease. Ischemia is decreased blood supply. Ischemic heart disease. And it will also talk on heart attack, technically known as myocardial infarction. So that's what we're looking at. We'll be looking at a little background data to kind of get us going, to refamiliarize. Now, this is a good one to kind of summarize a lot of the stuff I talked about in the heart. One thing, you can't know the abnormal like this until you know the normal. But sometimes the abnormal can help fortify your knowledge on the normal. So I hope this video and the one right after, there'll probably be a video 1 and video 2 to get it done, will help you to understand even more and consolidate your knowledge. All right. I start here first. Then I'm speaking on something called isoenzymes. Now, let me tell you what iso means same. So what an isoenzyme is, the same enzyme that does the same conversion, but it's slightly different in its structure in different cells. Okay, so let's look what I'm saying. Isoenzymes are enzymes that differ in amino acid sequences but catalyze the same chemical reactions in different cells. The existence of isoenzymes permits the fine-tuning of metabolism to meet the particular needs of a given tissue or organ. Okay, so the liver may need the same enzyme but to work in a slightly different way than the kidney. The isoenzymes characteristic at an organ, characteristic to an organ. The isoenzymes characteristic to an organ can be drawn and used to determine the performance of an organ. The drawing of these isoenzymes associated with an organ is termed drawing a panel, such as a liver panel or a cardiac panel. So when someone says we're going to do a liver panel, it would be to draw the isoenzymes apropos to the liver. Okay? All right. Cells produce enzymes that are used for metabolic reactions within the cells that produce them. Some of these enzymes are isoenzymes. As cells die normally, some of these enzymes are released into the circulation. Thus, there's a normal blood level. And I'm going to put the word concentration here. See, I'm developing this as we talk. There's a normal blood level, blood concentration of these enzymes in the circulation. If there's a massive death of cells in an organ, massive amounts of these enzymes will be released into the bloodstream. If blood is drawn and the isoenzyme levels are high, it points to significant past or ongoing damage to the organ. So in other words, we have a cardiac panel that we'll talk about. Cardiac panel a little later, but this has to do with the isoenzymes. Okay. So now we get to coronary artery disease and artery disease. Now, coronary artery disease, let's go over here. Here's your coronary circulation. It crowns around. We discussed that already. So here is coronary artery disease and artery disease. This one is for the heart, and this is just disease in other arteries in the body. Okay, we have what we call arteriosclerosis. Sclerose means to scar, versus atherosclerosis. Now, these are actually two different terms. You'll hear them used interchangeably sometimes and many times mistakenly. Arteriosclerosis is a general term describing hardening in arteries, any kind. Okay. Atherosclerosis is when, other words, arteriosclerosis could be due to just scarring. That'll make things get hard. But atherosclerosis has to do when there actually is a plaque, a hard calcified plaque put into the particular blood vessel. Okay? Artery is hardening, could be of the arterioles, small arteries. All right? But atherosclerosis is when you actually start getting a calcified plaque that's going to be. All right? And then we got other types. We won't really get into that. Okay. So coronary artery disease is also called ischemic heart disease. That's the other name, IHD. Ischemia is decreased blood supply to an area. Now, there are many things can do it. Cocaine can cause ischemia. We already talked about blood lipid levels, or if you haven't studied that, that'll be in some PowerPoints under my blood vessel section. Increased triglycerides, cholesterol. These are generally the main things that can cause this particular activity to occur. Okay. So we go further. Coronary artery disease, ischemic heart disease. These are other things that can cause that. Okay. So coronary artery disease, ischemic heart disease, is caused by atherosclerosis of large coronary arteries. Okay. And you can get this fatty buildup in there, these foam cells. The lipid deposits mess up the endothelial. The lipids can cause and precipitate. They can cause an atheroma. So here's a picture here to show you. Here's that plaque there. And see what that plaque does. Let's go over here. That plaque can cause occlusion, a closing off of areas, a narrowing down of that particular area there in that particular coronary blood vessel. See, up in the wall, these would be the endothelial cells. You start to get this inflammatory response, which ultimately will lead to a calcification that can occur. Okay. So what are some of the risk factors for this? Elevated blood lipids, high blood pressure contributes, cigarette smoking, diabetes. Diabetes contributes because of the way diabetics carry lipids. Obesity, things of this nature. Okay? All right. So the manifestations of coronary artery disease, okay, is related to a decrease in blood supply to the heart muscle, to that area of the heart muscle. And now, I want to come over here and say that decreased blood supply, it will cause narrowing and a decrease in the heart muscle. But you see what? Remember, we've got different coronary arteries. And you can use this. This can show you a decreased blood supply in the right coronary artery would be right here. Supplies the right atrium, right ventricle. So you can see, and also in this right here, what these go to. So a decrease in a coronary artery does not cause ischemia in everything. It just causes ischemia in those certain areas there. But you could have more than one coronary artery blocked off. They're variable. Some individuals are symptom-free, and some, that's what I'm talking about here, some experience that this is the areas of the body where ischemic heart disease can be felt. Can be felt in the arms, particularly the ulnar. See, this gets back, and you can go back and study your A&P to what we call referred pain. Here's the heart, but this is referred pain areas. Look back at A&P1 and neuro, and you can further elucidate that point to bring your knowledge up. Okay? So we go a little further there. See, again, here's that coronary artery supply that I was speaking of. Okay? Again, that picture there. Now, even when we do the EKG itself, which is the 12-lead EKG, it looks at different areas of the heart. even with the EKG. 12 different lookers. It's called a 12-lead EKG. You can look at my EKG PowerPoint to get an idea of what I speak of, a 12-lead EKG. But 12 lookers, and each one of them is doing differently, looking at different areas. Okay? So we will end this one right here. So this PowerPoint here is ischemic heart disease. Ischemic heart disease. See, my next would be heart attack, but I'm not ready for that because we first of all we have to set the stage, and that's for what we call ischemic heart disease. Now let's go over here before I do close this one out. So here's your coronary arteries. This is the areas they supply. Here's this. Right here is a narrowing. See, we just talked about that. Here is where you would feel discomfort. Now, right here, this is the standard EKG, loose segments, and that's in my EKG section. If you have on the EKG ischemia, on the EKG, this segment right here, known as the ST segment, may sag. This segment right here, which is known as the ST segment, may sag. See, let's look here. That's a sagging of that area. All right. Now, going further. Where it sags on the EKG would determine the location of which coronary arteries could possibly be involved. Now, I go a little further. Most individuals, though, if they have a mild closure, a mild occlusion here, may not suffer any pain or anything except on exertion. So they'll say that when I was shoveling snow or I was running, I started getting these pains, which means the occlusion was not that much, but when the heart really needed a higher blood supply, it couldn't get it because it was partially occluded. So then we do this treadmill test, And as you are on the treadmill, you start with a normal EKG. And then if all of a sudden it was normal and then that segment started to sag, the patient would have a normal ST, but as he increases speed and grade, it would start to sag. Then that's a positive treadmill test. Okay, let's go further. Now, all that did was to say that some blood vessel is involved. It doesn't really locate it, because even with that, and you're using this, it still doesn't say exactly where it is with pinpoint accuracy if you want to do something. So then we do what we call a heart catheterization. That's where you feed a catheter up and inject dye into the coronary arteries. And then they look at that and try to determine the exact location. So they try to determine the exact location of where the occlusion is. Now, see that narrowing right there? Dye has been injected. You can see a narrowing. How much the artery is closed is stated as percentage of occlusion. How much is open is stated as percent of patency. So if you have a 45% occlusion, then you have a 55% patency. Then what will happen is there are many different procedures to try to help with it. You could do a stent. You could try to cut the plaque out, known as an atherectomy. Or you could do, depending on how much closure, you may have to go and do surgery and open the chest up to do what we call a coronary bypass. And how many coronary arteries affected, that's how many bypasses. What you would do is bypass and hook it directly into either the aorta or one of these vessels here. That's what we call a coronary bypass graft. Okay. Now, so that's how we do ischemic. Now this will be for a heart attack we'll get into. So we're going to close right here.